Dr. Choll came here with the Formula One spine team, all color coordinated in blue. Also making the patient look blue, because all our drapes are blue too. Everything in the OR is blue for some reason. We have a very, very special patient. We need to do a really, really good job, in part because I did a previous surgery at L4-5 to treat that spondy. That looks perfect. But at the adjacent level, she has a disc protrusion and a small spondy. That disc protrusion goes all the way out to the left side, and she's got left low back pain and left groin and anterior thigh pain. She's tried numerous non-operative treatments without improvement, and she's not able to get back to her life, which includes traveling, since she lives both in Encinitas as well as Arizona. Encinitas is one of my absolute favorite cities in San Diego. And she also plays golf, which, as you know, another one of my favorite pastimes. So we have to do a great job so that she can get back to her life. She also happens to have a really important family event that she needs to get to and not be hobbled. So wish me luck. We're going to get started. We have the perfect imaging studies. I've drawn the perfect straight line freehand. But I want to go over some of the names of the instruments that we use, because some of the instrument names are so boring that we have to name it ourselves. So let me show you the spaghetti noodle dilator. That's what I really use. Probably the name is the initial dilator, but we call it the spaghetti noodle, because if I ask for the initial dilator, they give me three things and ask, is that it? If I ask for the spaghetti noodle dilator, it's like, psh. And then the pencil. Looks like a pencil. This is probably called the one-step blunt dilator. Let me have my favorite. So this is a long pituitary rongeur. It's got a little cup with an angle on it. And I love this instrument, so I call it the favorite. If I ask for the rongeur upgoing with a cupped working tip, they're like, is this it? Is that it? So my favorite, the curlicue. This is probably called the flexible rongeur grasper, but we just call it the curlicue because, yeah, isn't that such a better name? And then finally, the Viagra, which is the curved ball tip feeler, but we call it the Viagra because if I ask for the curved ball tip feeler, they're like, is that it? Ask for the Viagra. Don't ask me why we call it that, we just do. And then, all right, we're getting started. I've identified the perfect entry point, which I'm going to confirm with the needle first. And if it's not right, I can just move the incision later. Oh, I think this is going to be perfect though, because perfect is barely good enough around here. Okay, using the spaghetti noodle dilator to work my way to the surgical target site, using delicate Asian fingers, of course. Shot. And Dr. Asimov is going to be calling off every burst and spike. Shot. Because that's one of the ways I avoid the nerve. Shot. Anything, Ali?
No, flying so far.
The little finger flick tap to make sure that we don't get a jump. Oh, that's perfect. This is a kakapupu disc. Huge leak out the front. Starting to leak out the back now. Shut and save.
Time slide left DHL.
Sounds good. Whatever though. All your negativity is just making me stronger. Shut and save. There it is. Okay, I'm trying to get into the canal, but it's just completely blocked by all this stuff right here. So the laser is going to come in very handy to ablate this. And then once I get in there, I'll make sure all the nerves are free. Exiting nerve roots right there. Look away. You poor thing. No wonder you're having so much pain. Okay, here's the laser. If you're wondering why I use the laser, it's magical. Look how it just vaporizes this tissue. And it is really, 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 really precise. It's not electrical, so it will not conduct. It's mechanical, believe it or not. Photon energy, if you know what that is. So if the nerve was right next to me, I could work on it. That red laser is just the pointing laser, like you have on your pen. It doesn't do anything except tell me exactly where I am before I even press the button. More laser. That's the entry point to the canal right there. It's starting to see something. So exciting. Look at that, it's just a wall of disc protrusion. We're getting there though. It's amazing how well this laser works. It's a little bit of bone. That's the other thing, the laser works on the bone pretty well if it's osteoporotic. That's an osteophyte right there, a bone spur. And when it's together with the disc herniation, it's called the disc osteophyte complex. We just love coming up with names of stuff. More laser. This is the thickened fascicular encapsulated and ligamentum flavum that's occluding the exiting neural foramen and crowding the exiting nerve root like a tourniquet. It's not usually a pinching problem, it's usually a tourniquet problem. If it's pinching, it's painful all the time. If it's a tourniquet problem, it gets worse with activity or body position, because it chokes off the blood supply. And just face it, the nerve has to create electricity, so it needs to use a lot of energy. That's why the brain pulsates. How cool is that? Just think about that for a second. Things that make you go, Okay, the nerve is right on the other side of this metal thing. If I was using an electrical instrument, it could shock the nerve because metal conducts. The laser is photon mechanical energy, kind of. It doesn't conduct. So as long as you don't put this right on the nerve, it's very difficult to harm it. Look at all this tissue. Jeez. You poor thing. It's like gum in shag carpet. Oh, finally the canal. It's still, everything's stuck down and it's still occluded. But there it is. I can slide back and forth finally. Oh yes, oh yes. This is the Viagra, the curved ball tip feeler that I can deploy. Yes. Yep, adhesions. Picking gum out of shag carpet. This is what makes it bleed too, so I call that the forces of evil. Okay, now I'm using this as a downgoing Epstein. Oh yes. Don't even think about bleeding on me. That feels good. Most of the work is going to be right here. My favorite tutor next. It's like an empty cavity in here. It's okay, we still love you though. Then the curly Q after this. Curly Q goes up, so cute. Oh, whatever, Ali. I'm just a guy trying to be a guy here. Making sure there's no loose pieces wanting to come out some more. Working out laterally out the neural foramen. Look at how magical this is. And those little red spotches right there, that's what we call granulation tissue or inflammation. Alrighty, I'm done. So I've checked medially, and then most importantly, this is the exiting nerve root right there. I don't want to strip it. X-ray. And look at that, I'm underneath the nerve root there. X-ray. Save that. I'm just riding underneath the nerve root right there. I like a long time. Look at all these blood vessels in here. It's crazy. Yep. I'm going to get a little bit of that inflammation right there. But the nerve is now totally free and decompressed. And I'm really happy, and I hope you wake up feeling better, because if you don't, I'm going to be very sad. It's all done. It went perfectly. We did it through the little poke hole, and I bet you won't be able to find it in a couple of months. We're hoping that you get a lot better so you can enjoy your family event. I think it's a wedding. So best wishes on a speedy recovery. Right, guys? Alrighty, here's the radiographic summary. First, you get the perfect AP. Then you get the perfect lateral. And then you carefully advance the spaghetti needle dilator and put the needle in to the chromatodiscogram. That is a messed up disc. It's filling the back. And then it is creating a little outline in the back. Now I'm reaming, putting in the cannula, and then look in the AP plane to make sure I know where I am. That looks good. There's the ball tip feeler going into the canal and around the pedicle. Can only do that if it's in the canal. If it's in the disc space, it will not go down, obviously. That's how I know where I am. Now, look carefully right there. This is the exiting nerve that comes down like this. So I want to get all up and down that to make sure that it's free. I'm also looking down the endoscope, so I'm underneath the nerve root, all the way out to the extraforaminal space. I followed it all the way to the canal, and then I'm just walking my way up across, double checking because I check my car alarm twice before it comes in. The surgery went perfectly, so I'm really hoping that you get a lot better really quickly. So best wishes on a speedy recovery.